Let's discuss diagnostic approach in Chinese medicine. Four methods of diagnosis. In Chinese medicine, diagnostics applies the method of diagnosis to collect clinical information and based on this information to assess the state of health and the cause and status of illness of the patient. It is a discipline that comprises theories, methodology, and skills and has a rich content. It is fundamental to all branches of clinical Chinese medicine. In Chinese medicine, diagnosis depends upon the physician's ability to collect clinical information, to analyze and to infer logically, all without resorting to the use of any apparatus. It is possible to infer the pathological changes in the interior of the body from observation of external symptoms because the human body is an organic whole. All parts of the body are intimately and inseparably linked by the meridians. Because of this meridian system, certain pathological changes in an organ are always accompanied by tenderness in the organ's corresponding acupoints. Conversely, by finding the tender acupoints, the physician can infer which organ is affected by illness. CM diagnostics contain two major parts, the methods of diagnosis and differential diagnosis. The principal goal of the methods of diagnosis is to elicit and gather clinical data on the state of the patient's condition and the symptoms manifested by the illness. There are four categories of methods of diagnosis: history, inspection, auscultation, and olfaction and palpation. History is the process of determining the course of the patient's illness from its onset to the time of consultation by eliciting a narrative from the patient or companion and complementing it by further questioning. In addition to the information about the symptoms, a proper history includes the patient's living habits and exposures and the health and illness of family members, including the spouse, children and grandchildren, if any, siblings, if any, parents, and grandparents. Inspection means the visual observation of the patient's vitality, coloring, physical condition, and behavior. It includes inspecting the tongue for its texture and coloring and the secretion and excretions. Auscultation focuses on the sound made by the patient to infer the pathological changes within the body. This includes spoken sounds as well as others, such as those of respiration and abdominal cavities. Activities. Olfaction focuses on the odor emanating from the patient and excretions to infer the status of the patient. Palpation of the pulse provides much information concerning the status of the visceral organs, chi, and blood. In addition, palpation of other areas of the body also provides useful information on the condition of the patient or special features of the illness. Thank you for your attention.